Supplements are a great strategy because they can kickstart the brain's neurotransmitter production and help a person eliminate physical alcohol cravings. They can also help a person eliminate psychological alcohol cravings, but that tends to take a lot longer. And that tends to, supplements alone will never fix the psychological alcohol cravings. Supplements alone, well, maybe not supplements alone, but supplements and with at least a decent diet. Supplements that are customized and optimized for your situation, and at least an okay diet. Just that can eliminate physical alcohol craving. And supplements do not replace, but they supplement, augment, add to a healthy diet and lifestyle. Alcohol detox causes the central nervous system rebound effect. So since it's a CNS depressant drug, repeated use over time, we get something called neuronal adaptation. And then, so now our cells have adapted to this sedative hypnotic. And then when we quit, we get the opposite effect of the sedation. Now all of a sudden it's excitation of that same central nervous system. And it feels a lot better to, for most people, having a sedated central nervous system, especially when it's sedated with something that's also increasing your dopamine a lot. So it can be a sedated energy. It can be a really energized CNS depressant, but the fight or flight response typically doesn't feel as good. Even cocaine and Adderall and methamphetamines, while they can cause the fight or flight response, that's if a person's really sensitive and or if they're overdosing. Typically those make somebody, a therapeutic dose is going to make their brain optimized and have the good blend of sympathetic and parasympathetic autonomic nervous system drives going. So that rebound effect's horrible and it causes insomnia and physical and mental and emotional restlessness, anxiousness, nausea in the stomach, hot and cold flashes and goose flesh. And depending on the severity of the withdrawal, which depends on the severity of the alcohol use disorder, there can be different symptoms, more severe symptoms. And, to the most severe, you could, like we talked about, I think, last week on the withdrawal frame section, alcohol is one of the very few substances that cold turkey withdrawal can actually kill a person. There's 6 categories of supplements that one can use for alcohol detox symptoms alleviation. Those are anxiolytics, so powerful sedatives, natural, vitamins, minerals, essential fatty acids, amino acids, and herbs. And there's essentially 2 different supplementation methodologies. Formulas, that's these pre-made supplements that have multiple, oftentimes 5 to 10 or even more, even dozens of different ingredients or micronutrients. So for example, BioRebalance has a bunch of different things in it, amino acids and herbs, vitamins and minerals. And then Com Support is another really cool formula that has the same type of stuff, vitamins, minerals, herbs, those types of things and other nutrients. And then the mix and match yourself, you can get better customization, but the formulas is more simple and oftentimes it's especially easier to travel if you're using formulas to be consistent. There's daytime and nighttime supplements, regular supplements, which make up the vast majority of the supplementation market, all the nutraceuticals available on the entire planet. Most of these supplements are regular, which means they absorb in the human body at about 7 to 25%. So at those lower ends for tablets and capsules, powders, soft gels, and then at the higher ends, the 25% up in those ranges, that would be, the liquid supplements and things with higher absorption, patches and transdermal gels. Liposomal supplements are the gold standard. They're also a lot more expensive because of the technology used is more expensive to put in the products and also to create the products, to manufacturing. But they have about an 80 to 90% approximate bioavailability, so you absorb a lot more. So while it may seem more expensive oftentimes, if you get the calculator out and do the math on it with these absorption rates approximated in mind, then you could find out whether it actually is more expensive or whether it's actually cheaper or exactly the same for a product. Supplements can help a person who recently quit alcohol or any other drugs to start feeling good enough to actually begin other positive habits for their recovery capital, like exercise, nutrition to complete the key three, and then on into the other pillars of the psychosocial, environmental, and spiritual. Supplements only work if you use them, and if you use them consistently. There's some supplements that can be used PRN, which means it's short for as needed. Forget the word. I think it's like a French, or I think it's a Latin word. And then PRN's the short of the Latin, and the Latin word means as needed. So there are supplements. For example, one of my clients right now that's currently on kratom, using kratom maintenance therapy for self-treatment of pretty significant generalized and social anxiety disorders. And I was telling him, because now that his work push is over and he's got a bunch of time to mellow out, he wants to dial back on the kratom extract. So I told him about these different brands of easy melts and sublinguals of these L-theanine 200 milligram supplements that can help when he takes them with kratom to get by using much less kratom, or to either use it with kratom or in between his kratom dosages, because L-theanine increases dopamine, serotonin, GABA, and it promotes alpha brainwaves. So this is a PRN type supplement, but most of the supplements, a lot of the supplements, I'd say the majority, only work if you use them consistently. That means over the span of several days at least, but much better to use them over the span of weeks and months. Sometimes less is more when it comes to supplements, and also when it comes to the person, sometimes more is less. And yeah, after you find your miracle supplement, or supplements preferably, good idea to keep them in stock at all time.